Hello, everyone, and welcome. Thank you for joining us. From around the world in different time zones, my name is Irini Albanti, and I'm the Executive Director at Harvard Humanitarian Initiative. I'm excited to welcome you to our Social Impact in Humanitarianism webinar series. I will tell you a little bit about the webinar and then about today's talk and our distinguished guests. I designed this new series to address pressing issues in the humanitarian field and explore how humanitarian efforts create social impact for communities in crisis. One of the strategic goals of the series is to highlight the power of cross-sector partnerships as a catalyst for social change globally, how we in the academic and medical humanitarian setting can work with partners in other industries, such as technology, the arts, business, philanthropy, to improve the lives of communities in war, conflict, and natural disasters, and inspire action, how innovative collaborations like the one today's panel will address can raise awareness about critical global issues and offer different perspectives on how we can jointly tackle global issues. The webinar series brings together purpose-driven leaders who present their joint initiatives and talk to us about their commitment to reducing global inequities and impacting change for people in humanitarian crisis through their lens. Today, we have two exciting group of speakers who will tell us how community organized relief effort, CORE, and World Central Kitchen are partnering to provide disaster relief for communities in crisis. I will briefly introduce our esteemed guests and their organizations and then start the discussion. First, it is my honor to introduce Anne Lee, co-founder and chief executive officer at CORE. In this role, Anne provides vision and strategic leadership for a comprehensive array of programs, including reforestation, sustainable agriculture, education and youth development, community health, women's entrepreneurship, and extensive rebuilding and reconstruction efforts. Anne has almost 20 years of experience managing large-scale humanitarian response and sustainable development programming across a variety of sectors, including emergency relief, community upgrading and infrastructure, livelihoods and economic growth, and local governance. Prior to joining CORE, Anne worked at the UN's Organization for Coordination and Humanitarian Affairs, OCHA, serving as the lead on urban humanitarian response and as the private sector liaison for the Secretary General's World Humanitarian Summit. A little bit about CORE. CORE is a crisis response organization that brings immediate aid and recovery to underserved communities across the globe. Their mission is to save lives and strengthen communities impacted by or vulnerable to crisis. CORE responds to needs on the ground as they evolve while working to address the root of disaster. CORE was co-founded by Sean Penn in 2010 when mobilized a powerful network of doctors, emergency workers, and government officials to take immediate action during the earthquake in Haiti. Welcome, Anne.
Thank you so much. Thank you for having me.
We're excited. It is my pleasure to introduce our second panelist, Nate Mook, Chief Executive Officer at World Central Kitchen. Nate works hand in hand with the nonprofit's founder and activist, Chef Jose Andres. Nate oversees all World Central Kitchen operations, leading the organization's emergency and disaster relief efforts, as well as its long-term impact projects. He formally joined World Central Kitchen after helping create and lead the Chefs for Puerto Rico effort in the aftermath of Hurricane Maria that served nearly 4 million meals to people in need. World Central Kitchen was founded by Chef Jose Andres and uses the power of food to nourish communities and strengthen economies through times of crisis and beyond. When disaster strikes, the chef relief team steps out of the kitchen and onto the front lines to provide meals to those in need. This includes providing fresh meals in response to recent disasters, such as the Hurricane Ida in Louisiana, the earthquake in Haiti, the volcano eruption on La Palma, and the US-Mexico border. Welcome, Nate.
Thank you so much for having me. Excited to be here.
Here. So I would like to thank both guest speakers for their time and sharing their experiences with us, and also to thank their offices and Sabrina Sarli from Harvard Humanitarian Initiative for helping us coordinate this webinar. A little bit about the format of the 1-hour talk. I will spend the next 25-30 minutes addressing questions to the panelists, and then we will take questions from the audience for another 15 minutes. We will conclude at 2 p.m. Boston time. You may type your questions in the Q&A function on Zoom, and we will do our best to cover most of them. So I will start with the questions I prepared. October 16th was World Food Day, and we wanted to schedule this webinar around that day to celebrate this day. I will start by using the phrase on CORE's website, how it all started. both for your organization and your personal leadership story, the way that both CORE and World Central Kitchen started, your roles as the respective CEOs exemplify stories of entrepreneurship, social innovation, the power of philanthropy and leadership. So first, tell us how it all started and how the seemingly very different worlds and the visionaries, founders, co-founders, whether it's the actor or chef Jose Andres, how you establish your organizations. Anne, I'll start with you.
Sure. I had met Sean in 2010 after the earthquake. I had been living there before the earthquake for about 4 years when the 2010 earthquake hit. And meeting Sean was a huge eye opener. There was a lot of frustration that I had been feeling after 6 months of responding to the earthquake why are we responding in this manner? Why is humanitarian assistance being delivered in this manner? And here you had this outsider come in with a very fresh perspective and kind of this audacity to do things differently, to question things, to call people out using the media, to highlight some of the wastefulness and the terrible things that things were being done. And it was so refreshing. And we were really able to kind of come together in a way that created an opportunity for both of our respective organizations. I was working for another organization at the time, to do a pilot project that was so much a model of what we very strongly, which basically informed our ethos now, which is an integrated approach to humanitarian assistance, that it's very much a piece of our DNA to look at a neighborhood, a geographically anchored area that's been hit, and try to, through partnerships and through coalition building, to surround that geographic area with as much multi-sectoral support as possible. And that's really sort of how CORE came into being. And I joined 5 years later, but it's that outsider perspective that we continue to keep, because Sean has that audacity and that incredible sort of why does it have to be this way just because it's been this way, constant questioning that has really provided us the culture that has led us into so many different and new areas, like the COVID response space, when we're not a medical organization providing testing and vaccines and resource coordination. It kind of constantly drives us into new spaces in a very entrepreneurial spirit, and being able to take risks where a lot of organizations, really step back from that. And I think that's where, Nate and I and Sean and Jose have become such good friends, in that we really saw that, we're made from the same cloth. They're usually ahead of us, in terms of being out someplace and kind of getting in front of the risk and jumping into those burning buildings. So I think that, not just has it driven our internal culture of the organization to do what we do, but in that ethos we found and have been working very closely with awesome partners like World Central Kitchen.
Yeah, and I'll jump in, Irini. I think, our journey with World Central Kitchen, Jose's journey starting World Central Kitchen, began in Haiti as well in 2010 after the earthquake, but it actually kind of began well before then. Jose was watching sort of how the United States as a country was responding to crises involving where people were hungry and thirsty. And back in New Orleans after Hurricane Katrina, we all remember probably the images of the Superdome and, 15, 16, 20,000 people that were in this place, and there was no coordinated food or water. And it was a moment that was both a tragedy for the United States and also a moment where Jose really started to feel like there has to be a better way. This cannot be how we do things. And in many ways, sort of coming at it from the outside. He was a chef. He had a few restaurants at the time. He was certainly not as big as he is today. And, but it planted that seed, I think, in him about what can he as a chef and an entrepreneur and a restaurateur what role can he play in some of these major challenges that both our country and our world face? And that, really sort of this intersection with CORE and Sean Penn happened after the earthquake. Jose, in many ways, was really inspired by watching Sean, kind of just, go to a place, and try to figure out how he can play a role. Sean was watching, as Anne said, this tragedy in Haiti unfold and said, this isn't acceptable. We have to do things differently. We have to do something. And Jose was watching then Sean do the same thing. And at the time, Jose was in the Caribbean on another island at this fancy event with Anthony Bourdain and Chef Eric Ripert. And they were doing this thing for arguably very wealthy people who could afford to go down. And Jose had this moment where he was sitting there going, here I am feeding the few at this fancy event in the Cayman Islands. And that's fine. There's nothing wrong with that. But not that far away, you had hundreds of thousands of people killed or displaced and without food, and this really devastating earthquake that took place in Haiti. And Jose said, I don't want to be here feeding the few. I want to be there feeding the many. And that really was the beginning of a big shift in his life and the start of World Central Kitchen. But by the time, Jose got on the ground in Haiti a couple of weeks later, it was really initially just to learn. It was to see where, he was watching these situations like Katrina hitting New Orleans unfold. And here he was in Haiti. And he wanted to learn. He wanted to see where he could start to play a role. Of course, he jumped in, was cooking meals and helping get food to people, but at very small scale. And the organization really started that way. And at the time, Jose had never met Sean, but, here they were now together in Haiti after the earthquake. But a little bit different trajectory in that, CORE at the time, very quickly, Sean was overseeing a displaced persons camp of 70,000+ people. And just, Jose really, we had a much sort of slower approach to the growth of World Central Kitchen and started really one project at a time to see how, almost kind of test the waters, see where he could start to play a role, make a difference. And we began working on challenges like clean cooking, and we started a culinary school in Port-au-Prince and looking at sort of these small, Jose used to say, one plate of food at a time, one project at a time, kind of grow the work. And that really continued over the course of the next 7 years as World Central Kitchen began to, continue to evolve and learn. And sort of it culminated in this moment after Hurricane Maria hit Puerto Rico, when Jose and I went down and just realized there was no leadership. There's nobody in charge of food and water after disasters. And that's the one thing that communities need most often. And so as Anne said, you have to be there right away. You have to get on the ground quickly. You have to do this work. And so Jose and I landed in Puerto Rico and realized that there was no coordination. Nobody knew what was happening. Nobody knew how we were going to get food to all of these people. There's no electricity. There's no running water in most places, no communication after the big hurricane. And that really was the beginning of World Central Kitchen's work. And kind of in many ways brought us back together with CORE, working with CORE, because CORE arrived in Puerto Rico. And then since then, we've been able to work side by side in many disasters that have taken place both in the United States and also around the world as well.
It's great to hear about the story of the beginning and that a new friendship apparently evolved. And it seems that for both CORE and World Central Kitchen, you were both founded by visible individuals based in the US, doing work mainly outside the US, and sometimes being at an organization with a big recognizable brand name, whether a university or an organization, perhaps opens doors and give access to get things done. At the same time, as you mentioned, it creates huge responsibility and ethical considerations. And I'll go back to the two keywords that you both mentioned, both the ethos of the way that you worked and the very principle driven, and outsider, meaning when we visit or do work in another country, we are coming from a different place. We are not really familiar with the local customs, the local systems. We know that perhaps we need to explore what works for the community, what doesn't. Even if we arrive in a formal capacity, still, we can be the outsider. So what are some of the values and systems in place at your organization to ensure that your work is delivered ethically, with respect for the local society, and that it includes the local communities? These are considerations in the humanitarian field in general.
Just to go back in terms of what you're saying in terms of an outsider perspective, I see that less of like in terms of our work on the ground and our teams on the ground, as it is just never accepting that we've been co-opted by a system, humanitarian system, that we feel like needs a lot of reform. So the outsider perspective is outside of the humanitarian system. I think between World Central Kitchen and CORE, we feel so strongly that you have to work through communities and the systems there. So, CORE, we hire up from the communities that are affected, because those are the people who are going to know customs. They're going to know what's needed and how things are needed. So one of the things that our sort of secret tagline, that our mantra that we share with our teams all the time, is that our what we believe in is you have to listen, you learn, and then you act. And I see this so much in terms of what World Central Kitchen does, in terms of working with the local businesses to get them back up online instead of, being in competition with them. And, they're trying to get those local food businesses and the food systems as quickly as possible to, get back online. And I think having that the ethos is really like, we got to work with and through the existing things that are on the ground so that we reinforce them and strengthen them. And for CORE, how we do that is by working through local governments. We work through, CBOs and churches, but most importantly, all of our teams are from the affected community. So they're the ones that are able to talk to people to gain that trust and to, tell us what's needed and how to do things. So we feel very strongly about that.
Yeah, one of the things that Jose talks about a lot, and since I first met him as he was starting World Central Kitchen back in 2010, is the idea of empathy, that, we always have to lead in our work with empathy. And that really is about listening and learning, as Anne said, and understanding what the community needs, not what you want to bring to the community. Here's what I have to offer. It's where can I be in service of you? And I think one of the things that probably would surprise a lot of people is, despite, especially, more recently, some of the high profile attention on both CORE and World Central Kitchen, we're very small organizations. We are not, typical when you think of big international humanitarian organizations working in the places that we work, there are thousands, sometimes tens of thousands of employees, and they have these huge, teams. We're tiny in comparison. And the reason that is exactly what Anne mentioned, is we sort of have this model that we call at World Central Kitchen almost like an accordion, where when needed, we scale up to meet the needs of a challenge, of a crisis, but we do so by hiring local teams, by working with local partners, by working within those communities that are tapping into the resources that are already there, rather than having to bring everything on from the outside. A good example of this was in Puerto Rico, where FEMA was trying to get bread onto the island. FEMA is our Federal Emergency Management Agency in the United States. They were trying to get bread into Puerto Rico because there was enough bread to, get to families, and they were having huge challenges getting it in from Miami because the port was all clogged up. And so what we did was we just made sure we went to the local bakeries and we said, okay, what do you guys need to start baking the bread here on the island? And they said, well, we need fuel for our generators. So we said, great, we're going to make sure your generators have fuel. And then the local bakeries could start producing the bread, which then, and it's kind of effective solutions like that aren't, in some ways it's not rocket science, right? It's just common sense. And yet it too often it's not the way that the humanitarian sector has worked over the last many decades. And not only that, I think that the thing is that it's not only the better way to operate, but it's also way more effective. You can be so much faster and serve the community so much more effectively that way, the communities in which we're supporting. And so I think, as you said, it's so critical to factor that into the work, and that really drives our work as well wherever we go, and really leads with it. From the early days in Haiti, when Jose first arrived in Haiti after the earthquake, he was working, he was helping in a camp that had been set up, and he was helping cook some rice and beans to the Haitian families who had been displaced. And a group of Haitian women came up to him and said, "Hey, Jose, we love that you're here. Thanks for helping out. We appreciate all the support, but you're cooking the beans wrong." And, here Jose was like, he had all these restaurants, all these accolades. He was, interviewed by Anderson Cooper on 60 Minutes. And he could have been like, "What do you mean? I'm a famous chef. You're telling me." And he said, "Yeah, you're right. I don't know, how you cook. Show me." And these women showed him, because in Haiti, for the black beans, they like almost like a paste, like a puree. And so they took one of these bags and kind of like pushed the beans through and created this. And that, was a real moment for Jose, a humbling moment to realize, like, I'm not here to do what I want. I'm here to be in service. And that really, I think, has driven our work ever since.
I've been seeing that so much in this COVID period of, this is not rocket science. I say that like every other day.
But sometimes you just got to start, right? I mean, that's the most important thing is you can't overcomplicate things. You just got to get boots on the ground. You just got to do it. I mean, it's, to Anne's point, they were not a medical organization, but there was mass testing that we needed in the United States. And who was doing it? Nobody was doing it. So Corps was like, well, we're jumping in and doing it. And you start somewhere, and very soon, and just like we do with food, we don't step out of the gate and worry, okay, how are we going to feed 2 million people? We say, let's just feed the people right here in this community. Let's feed 500 people, 1,000 people. Tomorrow, we'll figure out how to feed 3,000 people and 5,000 people and 10,000. By the end of the week, we're going to figure out how to feed 150,000 people. And so it's just getting that going, starting somewhere is really how you can do this.
Yeah, it's great to hear this very solutions-driven approach, and also listening to the community, what is needed on the ground, because sometimes, again, we go with our own assumptions or perceptions. And also it seems that both your organizations, the common values you have, the common ethos in the way that you operate. And as I mentioned in the beginning in my introduction, the goal of this webinar is to highlight the power of similar partnerships and the fact that we need help and expertise from different fields if we want to see long-term change. And for us, in an academic, research, and medical setting, sometimes we tend to be very siloed and not look outside our bubble. So how have your organizations come together and worked through an integrated response to jointly address a crisis, whether it's recently in Haiti or somewhere else? And what makes this type of partnership strong and meaningful to the people that you serve?
I think Haiti could be the most recent example where we've seen this, right? Nate and Nate's team, the World Central Kitchen team, are always so fast and so good. And food is so critically important within the first few days.
Yeah.
It really sort of open up access to the rest of us a lot of times. And we work really closely with sort of the identification, the last mile, and all kinds of stuff to kind of provide as many services as possible. Nate and I have been talking at length and dreaming about, having partners so that it's much more of like when you're looking at an affected community, they're not looking in terms of specific sectors, right? They just want to improve their situation. So that includes food, water, shelter, so on and so forth. And instead of having different groups coming at you in so many angles, and it's so disruptive, you have assessments from this team and an assessment from there. And it's so much better if we can flip that burden onto us so that we can coordinate beforehand and come together with a package of services. I mean, that's the dream, right? We're not anywhere close to that. I think we're lucky in that we are such good friends. Nate and I, just on a personal level, Sean and Jose have their own bromance going on, that, we know each other's teams and we know each other so well that we do this anyways together, right? So we know we're going to be in Haiti, and it's like, I went to this community, we're doing shelter, we're doing debris clearance, we're doing cash for work. Can you bring food? Usually they're like, we're already there. But we're able to do that jointly, but it's just World Central Kitchen. It would be phenomenal if we could have 3 other organizations that are providing other services as well, that we can go together and say, these are the different things that we're providing to support you over this first, emergency phase, but as quickly as possible, like try to get you up on your feet to more like the resilience recovery period. So, I mean, I think that's what we've been dreaming about, and trying to focus on, like, how can we put that burden on, the humanitarian workers rather than the affected communities. But we're a long way off. But until then, at least we know that, wherever we go, World Central Kitchen is always there. They're there first, and they usually share with us information. And this is also such a unique thing, because organizations are often very competitive. They don't want to share information. And sometimes I think it's just also because they're just so busy, right? They're just like running around trying to figure things out. Never with World Central Kitchen. We've always shared information about what we're seeing, our assets. Do you need a ride, or you need to get your materials out there? We have a box truck, we'll get you out there, and vice versa. They're flying us out. It's like this incredible openness, and how it should be. But unfortunately, they're a rarity, and our relationship is 1 in a million, really.
Yeah, I think I couldn't really say much more to that, but I think it is, this humanitarian space, as you said, Irini, has been very siloed for quite a long time. People are concerned about funding, they're concerned about, a lot of things. And so they tend to work individually, independently, and not collaboratively. And I think what CORE and World Central Kitchen have learned over the past many years, and this has been from back in the day in Haiti, and more recently in places like North Carolina after hurricanes, and during COVID, where we partnered side by side in Navajo Nation, to the Bahamas in 2019 after Hurricane Dorian. And what we've been finding in all of these situations is that it's so powerful to work together, because as Anne said, these communities they need a complete solution for so many things after a disaster strikes. And it's not one thing, and no organization can do everything. And so, the best thing to do is really work side by side and have the teams work together, because we all have our own strengths, right? And so, I think that's why we love working with CORE, because they can do so much and adapt to the needs of the community, and figure, and as Anne said, working locally and building these incredible local teams. And so it's so easy for us to plug in. So our hope, and I think, we've been getting more and more organizations engaged on this idea of, how can we change the way that this type of work is done, to be more holistic, to be, more collaborative, and in advance, not wait until we get on the ground. I mean, even when right after the earthquake struck in Haiti in August, the 7.2 earthquake, Anne and I and our teams were already talking as we were en route. We actually, some of my team jumped on a plane with Anne's team, and it was this sort of collaborative opportunity even before we really even started working on the ground. And so that type of mindset, I think, has to shift in the humanitarian space. And I'm hopeful that as there are more organizations like ours that are coming in with a fresh perspective and new approach, that'll start to change. But we are also going to need our governments to do the same. It still remains a huge challenge. I'll give you an example. We were in Honduras after Hurricane Eta and Iota hit last November in San Pedro Sula, and World Central Kitchen. We were on the ground very quickly after the hurricanes, we very quickly, within days, we were providing meals to a couple dozen shelters. We were going into communities. We had partnered with the local military to do helicopter deliveries, and they had high water vehicles because there was still a ton of flood water from these 2 hurricanes. And about a week after we had been on the ground, the US government USAID team showed up, and they started doing assessments. And again, there's no problem. We love the USAID folks. We work closely with them in many areas, but it's a good example of where we had already been on the ground for a week. We could tell you exactly how many people, what the needs were in all the shelters. World Central Kitchen, we were bringing mattresses to some of the shelters because they didn't have certain, we bring sometimes other things other than food. But there was no coordination or communication there. So here USAID shows up and starts doing its own assessments, just kind of replicating the work that we had already been there for a week. And so I think if we can start to shift that and start to improve that, the end result will be much more effective support and working side by side in the communities that are impacted by these crises.
That came out of, remember we were talking after this most recent time in Haiti in terms of sending our front teams together when you guys are doing the food delivery, so that we can start collecting information and then figure out sort of what other stuff that we can bring to those communities early on, because it's often that it's happening before anybody else gets there.
Absolutely. Yep. And that's sort of on the ground. When we're delivering food and water, especially in those early hours and those early days, we're also able to get information. And so to have that ability, and then, there gets to be a certain point where, there's almost this sort of overlap of needs, and we figure out how, okay, where are things going in the community? Who needs the longer support for food? Are the local businesses back up and running? In Haiti, one of the things we were able to do was we were able to set up a voucher system in some of the communities where we didn't have to keep delivering the meals ourselves, but we paid some of the local vendors that were there to produce the meals. And then we gave these vouchers to the community. So it worked out. So as Anne's team were in there, they were doing debris removal and fixing houses and getting sheltering set up for families that had lost their homes. As those small businesses started to get up and running, we could sort of pull back some of our emergency food deliveries and let the community kind of get back up on its feet. And that type of work is only possible because we're collaborating, with CORE in these types of situations.
And going back to what Anne called this a dream, definitely sign me up. This sounds like a magical dream. All this knowledge sharing or bringing down the silos. And again, being part of a huge, almost Byzantine bureaucratic institution like big universities, big hospitals. Maybe we are innovative and there is a lot of intellectual creativity, but nimble we are not. So what you mentioned about efficiency, doing things fast, that would be great to be able to incorporate that in our response or in the way that we work. So seeing really how effective you are on the ground is definitely a dream. And keep me posted on that. And then you mentioned shared plane drives or just sharing information, sharing resources on the ground. And I'm shifting a little bit towards operations and a more logistical question of what it takes to organize the various pieces to manage a large operation like yours. And I know from my personal experience in the past, I was the deputy director of a general hospital, and I was in charge of evacuating and hospitalizing people from Libya back when Arab Spring was happening. So I would get a phone call at 2 a.m. saying that a plane arrives with 200 people and get ready. So for you, what happens when you get that phone call in the middle of the night that you need to mobilize your teams to respond to a hurricane or another crisis? And what needs to be placed from an operations perspective, logistical perspective? And what do you need to think as a leader to orchestrate this and be as effective as you mentioned?
Nate,
yeah,
you guys are logistically like
yes.
awesome.
Yes.
All right, I'll jump in first, and then Anne, I think especially, Anne's work during COVID has been, I've been so blown away at how they've been able to scale up and logistically testing vaccines. Just incredible. From our perspective, I think as you said, Irini, we always have to be prepared, because it seems to be that the big disasters tend to happen, the humanitarian crises tend to happen like midnight on a Friday night. This is not like in the middle of the day during the work week when you're expecting it. So our teams are always on call, ready to go. We're always in constant communication, monitoring everything that's happening around the world, really, from right now, the crisis in Ethiopia to, migration from South America up through Panama and to the southern border, to the storms that are taking place around the world. We're always, I've sort of become like an armchair meteorologist. I'm like, okay, do we need to worry about this one? And you just kind of have to do that. You always have to be ready. And so that communication is sort of constant. And then when something happens, one of the first things that we actually do is we try to, if we can, connect with the local community. From a food perspective, because that's primarily what we're doing, food and water. One of the real powers that we have is that the food community is very interconnected. The culinary world, chefs and restaurants. So, an example of this is a big earthquake in 2018 hit Indonesia. Actually, a number of earthquakes and tsunamis hit that year. And through some connections at a restaurant, we got connected up with the Chef Association in Indonesia, which connected us up. And within minutes, all of a sudden we have this incredible network of people already there on the ground who know where supplies are and resources and where to stay and all of these things that, could take a week if you didn't have, that at your fingertips. So that's one of the first things that we do is, who do we know? Let's get in touch with them. Let's get, what are they seeing on the ground? What are the resources that we might need for us? Kitchen space, accommodation, food suppliers and distributors. And we start to get that. So as our teams might be getting on a plane to head out somewhere, we are already starting to build that local capacity and that local network on the ground. That's one of the very first things that we do. And as we get on the ground, it's hard to, it's kind of hard to summarize because every situation is so different. But we send in a team, as Anne was saying, one of the first things that we do is we send what sort of our, what we call our emergency response team. And they're, within hours, they're either already there or en route to be somewhere. And for us, it's so important to have boots on the ground. You can't be sitting around in an office somewhere, sort of deciding how you're going to respond to something. You need to be there talking to the people, witnessing firsthand what's happening. We need to get on the ground. So we send this team, usually a small sort of initial team, as we're mobilizing a larger team to get together. And that team gets on the ground and starts reporting back. They start sharing what they're seeing, what the needs are. And we start to formulate kind of in real time a plan that we know is going to adapt and change over time. Jose often says, no meetings, no planning, just cooking. And it's it's kind of cliche, but it's also really true, right? That like we don't have time to sit around and talk about stuff and to plan stuff, because you just got to go in, see what's needed and start moving to fill in those gaps. And the plan sort of comes together in real time. One of the things as well is we start mobilizing our logistics, depending on what's needed. So what can we get locally? And if we can't get things locally because of the scale of the disaster or what's happening, what do we need to bring in from the outside? When Hurricane Dorian hit Abaco and Anne and I were working together on the ground there was very little left on the island of Abaco because the storm, this Category 5 storm, the biggest the Atlantic has ever seen, was moving 1 mile an hour over Abaco, killed countless people. There was no infrastructure of sorts to utilize. So we had to bring in a lot of outside infrastructure. It was an island. We had to get helicopters. We had to get seaplanes. We had to get boats. So you just start to mobilize the things that you need to be able to respond logistically. We have some warehouses where we do keep some items, things that we may need to move in if needed. We did have to bring some things to Haiti in August and September when responding to the earthquake. But we try as much as possible to source locally, right? Because then it keeps the money in the local economy. Businesses that are often affected by that disaster that you're responding to, they're also impacted, right? So how do you keep that, help them get back up on their feet faster? And we saw this during COVID as well. The last thing I'll mention is just sort of the adaptation to what the circumstances are. as we were watching this pandemic unfold, we had a very early view of this because we were out in Japan when the first cruise ship was quarantined in early February. And so we started to prepare because we knew this was going to come to the US and beyond eventually. So, but we realized very quickly that World Central Kitchen wasn't going to be able to be in all these communities. We can't set up kitchens in hundreds and hundreds of cities in every state because COVID is everywhere. But what we realized was we could be smarter and we could turn restaurants into community kitchens cooking for their communities. So we adapted our model, and instead of us going in and cooking everywhere, we put those restaurants to work. So we were able to support them. We paid them, and they were able to pay their staff and keep their lights on and pay their rent. And then we were able to help coordinate getting meals out to the community. And so, sometimes it's sort of more traditional logistics of like, we need to get stuff in and get it on a container and get it into a place. But most of the time, as much as possible, it's what can we get locally? How can we move fast?
Mm-hmm. I think the whole local approach is so critically important to support businesses and communities, because getting the livelihoods back up and running is so important. And that's what, I think, again, where we really align. I mean, for us, as Nate was saying, like, you can only plan for so much. You can have warehouses with pre-positioned materials. Hurricanes give you a little bit more time because you can see it coming and you can track it. Often what our teams do in those situations is that we overlay social vulnerability indexes, racial inequality, and high risk, high flood zones or what have you, to then, kind of target those areas because of the communities that we are focused on, and basically hopefully if we have enough time to basically pre-position materials in those areas. So, when you can plan out those things, then it's great. Oftentimes when you have something like the earthquake or, whatever it may be, or, COVID, something that kind of comes out of, someplace new or sort of unplannable. It's, again, why we share such a strong connection. It's, you can't let perfect be the enemy of good, and you just need to get down onto the ground and figure it out. Because often, even if with like the best planning, the best sort of like tabletop exercises and all that stuff, like all those things fly out the window the minute you land on the ground. And if you keep to those core principles in terms of buy everything locally until you can't, make sure that you're listening to understand what's needed and being able to shift and pivot very quickly, depending on how quickly these change. Because in these disasters, so much changes so quickly. So what is like the most needed thing in that moment? Like everyone saw in India, oxygen. Oxygen was like so critically important for 2 weeks. And then all of a sudden it was like not an issue anymore, So it's like, then you have all these extra oxygen tanks and machines and stuff. And then what, it's like, it's sort of like this, you got to be able to kind of move very quickly and shift into these priorities that change every week. And doing that means that you need to have your ear on the ground. And the best way to do that is having that local team. So when, having those midnight phone calls or what have you, like, it's, again, I can't emphasize enough about our culture. It's, our teams, we're not, neither of us are, I love your cat.
Sorry about that. He just really wanted to say hi.
Neither of our organizations are big at all, so this is just, really, it's been an interesting exercise for us, because it's sort of like, we've been able to do a lot with such a small team, and we want to continue it that way, because what we have are a few but extremely mission-driven people who are doing this not for the money, not for the glory, not for anything else, but because we feel so strongly about the things that are important to us, our principles of like being very locally driven, making sure that, we're supporting communities in the long term, and then by helping with them with the immediate term and making that crossover into that recovery resilient space. So, I think it's all to say, getting those phone calls and kind of jumping into these crises, it's now become part of the DNA of every single member of our staff, where there's no hesitation for them to kind of jump in, get on the ground, and also sort of continue on with our approach, which is to work through the ground.
Yeah, and it's, I think also, despite being small, that approach also means you can have tremendous impact, often way beyond what, maybe a traditional approach or what has happened previously. I mean, CORE, probably at one point, or maybe overall, CORE probably COVID tested more people in the United States than anybody except the federal government, right? I mean, and here you have, an independent nonprofit doing this, and the amount of vaccines that CORE, put in people's arms, just unbelievable. And both of our organizations were able to get up and running in India during the worst of times, during the Delta surge earlier this year. And in the beginning, Ann and I weren't even there on the ground, working with, leaders that were already there on the ground. World Central Kitchen was able to activate with our local Indian chefs and partners there a network of kitchens. We turned these airport catering kitchens into kitchens to cook for the hospitals and serving. They were preparing tens of thousands of meals, and I think we were in 19 cities simultaneously. And our World Central Kitchen staff had never even left the United States yet, because it was challenging to coordinate and get visas into India, and because of the COVID lockdowns. And so it's just a perfect example of how, it's not only, I think, the sort of the better, the more, just way to operate and the smarter way to operate, but it's so much more effective and efficient in what you can accomplish that way. Mm-hmm. And what that means, of course, is that any dollars that then get donated or put into these efforts, more of those dollars can then just go directly to the work on the ground. You don't have, you're not paying for these huge overhead of staffs and the flights and all of this stuff that tends to bog down these major organizations. Historically, we can be so much more focused and efficient with how we utilize that donor money, which right now is the expectation, right? I mean, I think this is people don't want to, donate a bunch of money to an organization, have no transparency and not know where it goes. People want to know exactly where their dollars are going. Mm-hmm.
This is a great point. And as you mentioned, perhaps not huge or big, but definitely mindful, definitely impactful. And I do have a couple of questions, but I see some questions on chat, and maybe we can address some of the audience's questions. The last one I have on the feed is, how do you verify that your organizations are not duplicating efforts or competing with pre-existing responses? And how you conduct research to verify that we do not reinvent the wheel with the research approach that we take?
I think the most critical thing, even though we go down on the ground and work locally, Nate and I in particular are very sensitive to the existing infrastructure of humanitarian assistance, whether it's through OCHA, whether it's through FEMA or emergency management agencies, so that we can avoid that. Basically knowing who's doing what where is critically important. So even though I feel very strongly that both the UN and the OCHA system and the FEMA and the VOAD and all of the national systems of coordination needs a major reform, they are useful in that, we do work with them and ensure that our information is shared widely, because, we've seen duplicative efforts a lot of times. And so for us, I think we're very accustomed to also partnering. There's only, you see the same people in a lot of the disasters over and over again. And so there's a huge amount of communication that's happening laterally between organizations as well as these larger sort of coordinating bodies. And that's important. So it's kind of like how I feel about the church. I believe in God, but not necessarily the church, so it's like, I like the spirit of coordination. We're just not quite there yet with the bodies that are in place right now. But despite that, we do plug into those coordination mechanisms, because, dollars are scarce. And we all know that those dollars are only there in the first 2 weeks, 3 weeks maximum of an emergency. And then afterwards, attention goes elsewhere, and those dollars ramp down very, very quickly. So stretching out that dollar to hit the ground and maximize the work on the ground is so critically important. We can't afford to duplicate. So
yeah, and I think to add on to what Anne's saying about both the opportunities and the challenges of some of these coordinating entities, this is why boots on the ground and being on the ground and working with the communities is so important. When we talk about hiring locally, oftentimes we're hiring and working with local organizations that are already there. Anne mentioned CBOs, community-based organizations. Almost all of World Central Kitchen's work during COVID across the country was only possible because we partnered with the community-based organizations to identify where the needs were, to help us distribute meals. And we do the same internationally as well. In the Bahamas, when we got on the ground and we started to prepare things and meals, we were seeing because we were there, we were coming across, even if some of these smaller organizations that were doing work or already pre-existing doing work in their communities weren't plugged into the UN system, we'd come across them by being there physically. And so then we would say, well, great, you're here. How can we support you? How can you work with us? I see World Central Kitchen in some ways as a platform. We have this voice. We have Jose's voice, which obviously is big internationally. He can bring attention and awareness and hopefully funding to communities, affected communities. And Sean does the same thing. Goes on TV, not to put himself on TV. Goes on TV because people need to care. People need to know what's going on. And we live in a world where, it's some, silly, politician makes a comment and all of a sudden that's the news for the night when you have people that are starving and nowhere to sleep. So, I think it is, for us, we really see our work as an enabler, right? World Central Kitchen, we want to enable the communities and the work that's being done. And oftentimes that means we can do that best by partnering side by side with much smaller organizations. And because we have the ability to maybe raise funding a little bit easier than they do, we can then channel that funding to them in the process. And so, it's not perfect, and it's something that we need to do better at, because there are so many voices that are left out of some of these big coordinating bodies. But I think you just got to kind of bring in sources from everywhere and try to bring folks together.
Mm-hmm.
This is great. And throughout the conversation, you raised a few things: the need to raise awareness and advocate for the need, transparency. We talked about empathy, listening to the communities, and the need to reform the humanitarian aid field, make it more equitable, make it less racist, make it more accessible and efficient. So we are approaching the end of the session. I would like to thank Nate and Anne and the special guest, Nate's cat, for joining us today and sharing your stories, your experiences with us. We managed to address a couple of questions, but it was great to hear how both organizations are coming together, are joining forces to impact the field and help the communities that we serve. So thank you again. It's been a pleasure and an honor to have you. Thank you, everybody, for joining. And thank you again. Enjoy the rest of the day.
Thank you.
Thank you so much.